So I want to go over on how the cavity starts. The cavity starts by the bacteria invading the tooth. There's first layer and second layer of the tooth. First layer is the enamel, second layer is the dentin. When the cavity invades the enamel, often we say we can watch it, and that's when like the x-ray shows that the cavity is only on the first layer of the tooth. When it invades into the second layer, then we actually need a dental filling. And the dental filling has different types of dental fillings that we have. At our office, we don't use a silver filling anymore. We only use high quality resin, which is like a tooth color composite to fill the tooth. And believe it or not, there's different quality of tooth color resin that we can use. And it's more on the website if you want to be interested and look into it. But we use a high quality polishable dental resin that actually fits right to your tooth like shade and like the different shade of white. If you have a dental cavity, make sure to book your appointment so that way we can get the treatment started before it becomes too big of an issue that you're going to need a root canal. Because once the cavity reaches the pulp, or if it's very close to the pulp, then sometimes it requires a root canal and a crown, which can be prevented by doing just a single filling. When do I know that I have a cavity? You're not going to feel any pain when you have cavity. You'll only see it when you actually take an x-ray. When it's small, you're not going to feel that you have pain or anything. The only way to know that you have a cavity will be to come in for like your routine checkup and get your routine x-rays to see if you have a cavity, or like look at it clinically by a professional to make sure that you don't have any surface cavities that are missing from the x-ray. A lot of the times the surface cavities are very difficult to spot, and that's the reason why when you go to different practitioners, when you go to different dentists, they say, oh, you have one cavity, versus another dentist can say, oh, you have 10 cavities. Now that's an extreme from like 0 to 10. A lot of the times people ask me, why do I get all this different treatment plans when I go to a dentist? Isn't dentist a dentist? So I want to really touch upon that because there's two extremes. Like one could be that the dentist is not diagnosing enough. They're not seeing the problem in the patient, that it becomes too big of an issue later down the road when it can be when it can be prevented as a smaller like cavity lesion. Versus, yes, some people, like some dentists, could be unethical and present you with all this filling when you don't have a cavity. We see both sides as specialists because a lot of people come in for second opinions to us. It's always better not to touch teeth if you don't have to. Even if it's like a surface filling, I would not recommend it if you don't have a cavity. There's no preventative filling unless the dentist actually tells you. If you have like a bruxism habit, if you're grinding, then sometimes the second layer of the tooth is exposed, then yes, that entails like a preventative filling. But I don't recommend putting any kind of filling or bonding if there is no problem with the tooth. But it's always, at the same time, it's always better to prevent the problem from getting bigger by taking care of it when it's a smaller problem.